Did you know that this cuff on this ET tube and the pressure that you maintain in it is the most common reason why respiratory therapists are sometimes sued in court? That's because keeping a proper cuff pressure is ridiculously important. So let's go over it. Hey everybody, Dennis here with Respiratory Sensei, and today we're going to be looking at ET tube cuffs and cuff pressure. I have here with me a size 10 endotracheal tube. Now that's an awfully big tube. That's big enough to ventilate a horse. You're going to be ventilating people, so you'll probably use a smaller size. Probably size 8, maybe 9, but probably a lot of 7, 7.5, and sometimes even 6 and 6.5. But what's important about this is that this ET tube cuff pressure has to be maintained. And so let's take a closer look at it. We'll talk about the pressures that we need to use to maintain this cuff properly to not present a danger to the patient. All right, so let me just take this down here. And as you can see, we have, I've already mentioned, we have the ET tube cuff here, and then we also have what's called the pilot balloon. Now the pilot balloon has a very small valve in it, and when we stick something in there, such as a syringe, then that depresses that valve, and then that opens up the cuff, and that's how we can stick air into it. All right, and so we have that. One thing I want you to notice right off the bat is that the ET tube cuff there's no air in it. And so it's all scrunched up. You can see it's evacuated, we would say. And then because also there's no air there, you can also see right here as I look at the pilot balloon, if I turn it sideways, it's also flat. And that's because there's no air in there. Turns out we're going to be able to use this pilot balloon to look at later to decide, is there air in the ET tube cuff? And especially whenever the patient is already intubated and we can't see this, we certainly can't palpate it. All right, so the next thing we're going to do now is we're going to put air in the cuff. And to do that, I'm going to use a 10 cc syringe. Now, people often ask me how many cc should go in there. And there is a volume, but it depends on the cuff size. So you'll usually never find a book that gives you an exact number. People will say anywhere from 5 to 12 to 15 cc's. What we're going to do is just put air in there until we get full visually, or if it's in a patient, we have to put air in there until we receive a certain pressure, and we're going to talk about that in just a minute. Okay, so let's come back down here. I'm just giving myself some good amount of air in the syringe. Notice here that I have to push in the little pilot valve before I inject some air. And as you can see, as I do so, I'm going to put in a little bit more, that what you're seeing is the cuff in the background. It's getting full. And now look, it's pretty full now. Now if I look at the cuff, it's pretty taut, and you can see that. But let's look at the pilot balloon, because this is going to be outside the patient. I'm not going to be able to see this. It's going to be inside the patient. But as I look at the balloon, can you see it's also full? In other words, if I go like this, it also feels a little bit taut. And you can get used to this feeling sometimes, because if it feels extremely taut, then you know you might have too much air in there, and you can kind of get a good feeling of what it's supposed to feel like. Now, that we're not going to rely on that. We do need to bring a pressure manometer to place so that we can see that, but this is the initial way on how you do that. Naturally, if I were to evacuate, then what I have to do, remember, I have to stick this in far enough so that I can pull the air out of the cuff. And as I do that, we're going to do that when we're extubating somebody. We might have to put the syringe in a few times and evacuate that until we can feel that there's no more air to come out. Anyway, and that's how you operate. That's the basics of an endotracheal tube, including putting air in and out initially with this 10 cc syringe. Now, there are other devices that we can use, and one's called a pressure manometer called a Posey Cufflator. That's just one brand, but it's a very, very common brand. We'll take a peek at that in just a minute. Now, as I said earlier, as you use your 10 cc syringe to put air into the cuff, or you might use the 𝗃𝗄lator, another device with a bulb that we'll show you here in just a minute, you can fill the cuff up, and what you're going to be looking for is a certain amount of pressure. We'll go into this more in hemodynamics, because it is a hemodynamic issue, but there is a certain cuff pressure that you should not exceed. I'll just give you a hint though. If we do exceed the cuff pressure, if we go above what its maximum should be, then what's really going to happen is we're going to put so much pressure on the inside of the trachea that the blood capillaries flowing to the area around where the cuff is will divert and go other directions. And that'll leave the tissue right around the cuff without blood. If you do that for very long, you can have necrosis, 𝘃𝗱𝗂𝗰𝗁𝗇, and a variety of other problems. And that's why we want to make sure we keep the cuff pressure at a proper range. All right, now let's take a look at the Posey Cufflator manometer, just as an example of a pressure manometer that we might use to check cuff pressure on an ET tube cuff. All right, now as you look at this Cufflator face, what you'll see is that it has a little white needle, and right now it's at 0, and we'll play with this here in just a minute. But as you jack up the cuff pressure, then that needle should rise, and you're going to want to keep the needle in the green zone. If it's in the green zone when you're finished, then you know you have a proper cuff pressure range. But look, there's also above that a red zone, and that would indicate if your needle's all the way up in the red zone, then you'd have too much cuff pressure or too much air in the cuff, causing too much pressure to be pushed on the tissues of the trachea, and that could be dangerous over time. All right, so let's just go ahead and with an evacuated cuff, let's get our needle down to 0, and then let's go ahead and add air and watch what happens to this needle. Okay, so here I have an evacuated cuff here, and I could be using the Posey Cufflator that is shown on the screen. I don't have one of those there with me, so I'm going to add air with this 10cc syringe, but it would be the same as if I were adding to the Cufflator. The Cufflator has, not shown here, it has a little bulb that you can squeeze, very much like a blood pressure cuff, and as you squeeze it, it just pushes air into the cuff, and then the needle rises. All right, and so let's just first of all, we'll add a little bit of air here, and we'll raise the cuff pressure up, not super tight, but we'll raise it to about 15, as you can see there. Okay, now if I put a little bit more air in my syringe and I push that down and I add a little bit more, and now the cuff pressure is looking a little bit more taut. Now we're close to 30, which by the way is probably about what we're supposed to be. Hey, but just for fun, let me just put in a little bit more air, and then watch how quickly it rises way too high. Now we're up to like 62. Now that's a very taut cuff. We really don't like it that high. That would be dangerous for the patient, but that's how the Cufflator is going to work and what it looks like in terms of pressure when we start adding air to the ET tube cuff. All right, now what I'm going to do is I'm going to take some air out of the cuff in a very interesting way. I want you to pay attention to this. So here I have my 10cc syringe, and I'm going to take this out just to facilitate something. I want to pretend like this is the Cufflator, and it has a big old reservoir. In fact, I'll just remove all that together. Now what I want you to do is watch the cuff pressure as I push this into here. As I go in and out, the cuff just deflated a little bit, and you probably noticed on the pressureometer it went down. And that's interesting. That means that when I push the cuff pressure in and out, I actually open the valve and I lose a little bit of air. And so watch what happens if I go in and out, and then in and out. Because I'm depressing that little valve in there, I'm losing air each time I do that. One of the things we want to draw your attention to is that even though you're going to bring the Cufflator up there and press that valve so you can put air in, while taking it out, there's just a moment there where the valve is open and you're going to lose some of it. We're going to come back to that in just a minute. Okay, so we need to make some conclusions. Whether I'm using a 10cc syringe or a Cufflator like I show here on the screen, whenever I'm going to check the cuff pressure, this truth is also true. And that is when I check it, I'm going to steal some air and it's going to lower it. That produces a paradoxical problem that I could put a Cufflator on the end of the ET tube pilot, jack up the pressure by squeezing the bulb, and then when I do, I might see a certain pressure, say 32 on the manometer, but as soon as I take it out, the act of taking it out causes me to lose some air, and that means whatever pressure I just measured before I took it out is no longer accurate as soon as I take it out. And so that's going to come to play in our calculation when we're sticking air into the ET tube cuff. Now, let me stop for just a minute, and here I have my ET tube cuff, and there's some pressure in there. The question is, what is the proper pressure? And a better way to ask that is, what pressure should I not exceed in the ET tube cuff? Remember, it's all about just putting pressure upon the tissues in the trachea. If you were to put too much pressure, then what happens there is that depresses itself on the tissues, reduces blood flow to the area, and can cause necrosis or death of the tissue to occur. And so there are certainly numbers that we don't want to exceed. Now, if I were to ask you, how much should you not put in, or what's the maximum number pressure that you should put into the cuff, what you'd probably tell me, just depends on what you learn, you might give me a number like 30 or 28 or 26, somewhere in that range. And that's true and not true, Now I'm going to say something controversial. Correct cuff pressure that you should not exceed is 20. Now wait a minute. You're probably wondering, why did my teachers tell me 26, 28, or 30? And better yet, why is it on the 𝗃𝗃𝗍𝗃 the green zone shows something closer to 30, maybe even 31 or 32? And it's because of this, and this is the most important thing. Generally, when we're talking about cuff pressures, we're supposed to be talking in millimeters of mercury. Millimeters of mercury are the same units of measure that we measure hemodynamic blood flow. And the pressure of the capillary bed in the trachea is at around 20 millimeters of mercury. That's the blood pressure there. So if I stick a cuff right next to it and I jack it above 20 millimeters of mercury, that's when blood wants to start to divert around to less pressurized area, and it avoids the tissues right around the ET tube cuff. So where did I get the 20 instead of the 26? And that's because the Posey Cufflator, the one that's most commonly used in the field, is not in millimeters of mercury. Rather, it's in centimeters of water pressure. And so the real question is, if 20 millimeters of mercury should not be exceeded, then what does that translate to in centimeters of water pressure? And the answer is about 28. It's about 27.5 something or other, but about 28. So in other words, 28 centimeters of water pressure, which is what many of you are taught not to exceed, because that's the unit of measure on the Cufflator that you're looking at, the manometer, that's its units, then that's equal to about 20 millimeters of mercury. Now, just a little bit of hint in my experience and just my opinion that if I was on the NBRC exam and I'm a respiratory therapist taking that test, I'm going to be probably interested in using millimeters of mercury. Why? Because the field from a hemodynamic point of view, it wants to see cuff pressure in millimeters of mercury, even though your little Cufflator is in centimeters of water pressure. All right, let's go back to our little manometer here, our little Cufflator. And as you can see, the needle's at 0. And then, of course, I have my ET tube. And then I'm going to have the Cufflator attached to the end of this pilot. And then the Cufflator has a little bit of a bulb. And if I squeeze the bulb once, then the pressure goes up to about 10, 12, right in there. If I squeeze it again, then the pressure's probably going to go up to about, I don't know, just shy of 20 centimeters of water pressure. And then, of course, if I squeeze it again, and now, look, now I'm up to close to 30, and maybe I'd make a little baby squeeze just to get it up to about 32. Now, that's good. Now, I just said that the proper ET tube cuff pressure should not be exceeded in centimeters of water pressure by about 28. So why on this Cufflator does the green zone go up to about 30? Well, that's because, remember, I'm going to go up to about 30, 32, and then I'm going to remove the Cufflator attachment from the tube. Remember what happens when I do so? It's going to go down. And so while I've squeezed that to go up to about 32, watch what happens when I take it off. I take it off, and the pressure drops. And it drops by about 2, 3, or 4, which amazingly is still in the green zone, but it's closer to about 28, 27 centimeters of water pressure, which is actually the appropriate cuff pressure. So now I don't speak for Posey, but it just makes sense to me that they've given you a green zone that you can jack it up to, just so that when you take it out, you're going to be in the proper cuff pressure after you remove the Cufflator and lose that marginal amount of air out of the cuff. So the main takeaway here is that cuff pressure should not exceed 20 millimeters of mercury. And that's the number that you really, really want to know for any academic reasons at all. However, if you're using a Cufflator, then it really shouldn't exceed 28 centimeters of water pressure, even though you might jack the Cufflator manometer pressure needle up to about 30 or 31. As soon as you pull it out, it's going to fall to the desired max of about 28 centimeters of water pressure. Remember that when you stick something into that pilot balloon, you're going to lose a little air, and when you take it out, you're going to lose a little bit more air. So you have to be able to compensate that. So now what you don't need to do is compensate by going above the green zone. Just go to the top of the green zone, and then when you pull it out, you should be at about the maximum pressure that you need on the ET tube cuff. Now, you don't have to be at maximum pressure. You could be at the green zone would be much less pressure than that, and that would be better for the patient. So don't think that you need to hit 28 or hit 30 on that manometer. As long as you're in the green zone and you can tell when somebody's on a ventilator at the top of each breath, just make sure there's no air escaping around the cuff. You'll know that because you'll sometimes see foamy bubbles coming from their mouth because at the top of inspiration, there's just a little air coming around the ET tube cuff, and it's aerating their saliva and causing that. Well, if that happens a lot, then you know you need to put in just a little bit more into the ET tube cuff. One more thing is that if you notice at the top of each ventilator breath that the person is losing air around the cuff and you see all those foamy secretions coming out of their mouth, but you check cuff pressure and it's already at its max, then here's the answer. You need to increase the size of the ET tube, because with the size increase comes an increase in the diameter of this balloon. So you might be using too small of an ET tube. If you have a 6 or a 6.5 in an adult, you probably should be using a 7, 7.5, or an 8, and that would be an indication of that. Well, I hope this has been helpful. This is Dennis Stanley with Respiratory Sensei. If you've enjoyed this video, please let me know. I like that. I like when you like it. And that tells me that I'm on the right track. And then please subscribe, tell your friends about it, and if you want to see more videos as they come out, then please hit the notify bell and to be sure so that you're notified when stuff comes out. All right, thanks again. We'll see you later.